The second advantage, according to most clinicians, is that you don't have to prepare the adjacent teeth. Hey guys, welcome to another session of the Finish Line project. And today's topic that we've taken up is dental implants. Now, dental implants have been in use for quite a while. I think it's almost been 5 decades since the first implant was placed in the human jaw. However, controversy surrounding their placements just never seem to end. And as probably as much of success that has been seen in implantology, what exactly is the problem is that a lot of practitioners are very cautious when it comes to placing implants because they just don't want to see it fail. Because failure of the implant not only means that the implant has failed in the jaw, it could also mean a lot of other things to the practitioner, right? You have to deal with the patient because implantology again is financially not, it's not one of those affordable procedures. It is a bit towards the expensive side, although affordable implantology has come into foray these days. However, it is a bit towards the expensive side. So, what exactly is a dental implant? What are the benefits of these implants? And whether one should place them in almost every situation or not, that's exactly what I'm going to discuss today. So, let's start off. Dental implantology started way back when Brainmark placed the first implant inside the human jaw. So at that time it had become clear that the implant, that is the metal or the titanium screw, as I would say, metal is a general term for the general public. As far as we know, it's a titanium based metal. So that is placed inside the human jaw because it's biocompatible. One of the major reasons why titanium is used is titanium is a biocompatible metal and it is placed inside the human jaw. On top of titanium, what we do is we have an implant abutment on top of which we place the prosthesis. So you have a fixture, that is the screw, on top of which you have the abutment, on top of which you have the prosthesis. Alright, so these three parts need to be very clearly understood, alright. And the prosthesis, it may either be cement retained or it may be screw retained. So screw retained means that this prosthesis and the abutment are one unit and they're placed on top of the fixture, that is the screw, and they're almost screwed on top of it, alright. Whereas in cement retained, the fixture, the abutment and the prosthesis are all different and the prosthesis is cemented on top of the abutment with the help of cement. Both of them find their use in diverse situations. Now, what are the benefits of dental implants? Repeatedly, studies have been conducted and it has been proven that implants play a major role in preventing bone loss, or I would rather say decelerating bone loss, alright? If we are to compare implants with removable prosthesis, the rate of bone loss in an implant supported or an implant retained prosthesis is far less as compared to the rate of bone loss in case of a prosthesis which is removable without implants. This is also known in scientific terms as resorption of the residual ridge. Alright, so resorption of the residual ridge is far more in case of removable prosthesis and it decreases with the use of implants. It still remains, you see, without the periodontal ligament and the tooth present, the resorption is still a factor. However, it can be decelerated with the help of implants. So that is one major advantage. The second advantage, according to most clinicians, is that you don't have to prepare the adjacent teeth as you would in case of a bridge. In case of a bridge, you have to prepare the anterior and the posterior teeth. And in case of an implant, no tooth preparation is required and the implant can be placed directly into the jaw. Another advantage of using dental implants is that the prosthesis can be, now this is something that I find a bit more controversial because I would say even in case you give a bridge, you can still have lifelike prosthesis. But as is understood that there can be a better variety of aesthetics according to some people in implant retained prosthesis. Why is that so? Probably you get more space to apply different shades of ceramics. Probably that is the reason why they say that the aesthetics can be slightly better in implants, because you can create all those camouflaging effects and you can get a much better tooth-like appearance. Whereas I think, and I personally know for a fact, that the same can be achieved with the help of bridges. Now, what are the controversies surrounding implants? The basic controversy surrounding implants is that, is it required in every case? Nowadays, if you notice, implantology is being done right, left, and center in the mouth. Implants are being placed anywhere, literally anywhere. Different types of implants are being used. All right. So, one very popular category of implants that is being used right now and has seen success is basal implants. And in situations where probably bone width is not sufficient, the clinician would go in for this type of an implant. Alright. I am of the personal opinion that, implantology need not be done everywhere in the oral cavity. There are prerequisites. For example, in case the patient is a smoker, it has been seen that the implant is most likely, almost 60% likely to fail in case he does not quit smoking. Systemic conditions have to be, if not ideal, at least optimal for the placement of implants. Implantology should be avoided in patients in which the systemic conditions are very severe, even if they are controlled with medications. Alright? Osteoradionecrosis of the jaw is an absolute contraindication for oral implantology. Considering all these factors, should you place implants or should we still go for bridges? There is no concrete dividing line that you should do this or should not do that. I think the basic thing is that one should come to a clear diagnosis before one gives any kind of prosthesis, be it a removable partial denture, be it a fixed partial denture, or be it an implant supported or an implant retained denture, or a single tooth, which may be again implant supported or implant retained, or which may either be given in the form of a bridge. In most situations, as far as the bridge is concerned, is there any advantage that the bridge offers over the implant? Yes, that is the presence of the periodontal ligament. As long as the periodontal ligament is concerned, you have a cushioning effect on the bridge. However, as far as the maintenance of hygiene is concerned, it is far more easier to maintain your hygiene in case of a dental implant. As I move forward, I am also going to talk about implant occlusion, in which you will be able to understand better which is the exact way to place your implant so that the chances of failure are as less as possible. Thank you for joining in, and I'll be back with another session.